Hey, everybody, it's Kevin Henry, the editor in chief for drbicuspid.com. Thank you so much for joining us for another episode of our podcast and another look at a product that has been reviewed by Catapult. And I'm thrilled to welcome in Dr. Priya Tirumalasetty back to the podcast to talk about another product. So, Dr. Priya, it's great to see you.
Thank you for having me.
So I always enjoy talking to you and working with you. And I know today we're going to talk about the Shofu. I'm sorry, I'll cut that out. And I know today we're going to talk about the OneGloss PS Polishing System by Shofu. And I know that you provided us some great background on this polishing system, as well as a few photos to help illustrate, and I very much appreciate that. So I want to ask you about one thing that you wrote in there, and you talked about how that the patient sometimes feels greediness after the restoration. And I just wanted to get your take. How important is it for that patient to not feel that?
So, patients are sometimes very sensitive to a change in their mouth. It's almost like getting a new pair of shoes where, you're used to how something feels and then you do a restoration and then suddenly it feels different to their tongue. They're going to want to keep going to that spot and it's just wired to set off this trigger. They think this is new, this is a change in my mouth. And so almost immediately when I finish a restoration, I say that should feel grainy, but it shouldn't feel sharp or pointy anywhere. And they say, yes, it feels grainy. And so then I reach for my one glass point, whether it's in the anterior or posterior, specifically for the posterior. If there's graininess, I can take that point right into the grooves that in the anatomy that's built in, and it eliminates and reduces the graininess down almost right away. So they feel a huge difference. And it's nice to have it because it's just one point that you don't have to think about changing grits. So it makes it easy.
And what was it? I know you talked a lot about this in the article, but for those viewers who want maybe the Cliff Note version, what was it that maybe stood out about this product to you?
That you can use different pressures to get more of a polish. So if you just want to lightly polish something, make sure you preserve some of the anatomy. You could use less pressure. And this is just pressure on the actual tooth on the restoration versus the RPM. And then if you want to just go a little bit further, you kind of dig in a little bit more. And so different pressures can allow for almost like different levels of polishing, if that makes sense.
Absolutely. And is this something that I want to follow back up on the gradiness question real quick? Is this something you think that maybe dentists sometimes maybe overlook? The schedule may be behind or whatever it is, and maybe they think that that's a step that.
Absolutely. So once you place the restoration, take everything out that you had in there, your cotton rolls, your triangles, your wedges, your matrices, then, adjust your occlusion. You could potentially be done. You're done. You've adjusted their bite and, that's that. But it's just so important to address the surface texture and make sure that there is, not that graininess factor that's going to cause them to want to remember that there's a new restoration. The more that they can forget about it and just move on with their life, the easier it is for them to get used to the new restoration. So I think the graininess is a very important factor to answer your question.
That's great to know. So one thing I wanted to talk about, and I know it's in the article, is kind of your view on polishing of anterior teeth, and I just want to get your thoughts on that.
Yes, so the one glass point is terrific because I start off using diamond points to create my depressions, lobes and internal depressions. So there's depressions and there's elevations, especially on anterior teeth when I'm polishing. When I'm done with my either carbide or diamond burr, I like to go back with my one glass point to define those depressions, remove scratches. So it really works great to get into those little grooves in the anterior to remove those, and that way you don't wipe out the anatomy that you just created, even in the interior. So one glass point works great for that.
Well, if you're watching this on YouTube, the link to the article will be in the video description, so very easy for you to find. And hey, if you're watching this on Dr. Bicuspid, make sure you check out everything for Dr. Priya that is above. Dr. Tirumalasetty, I really appreciate your time, and it's always great to talk to you.
Thank you so much. Nice to talk to you as well.
And we always appreciate working with Catapult to talk about these products that can make a difference in your practice. Till next time, it's Kevin Henry, editor in chief for Dr. Bicuspid, signing off. And as always, wishing you nothing but success ahead.